What if the medication you trust the most is actually the one your heart struggles with the most? Most adults over 65 worry about cholesterol, blood pressure, and heart attacks. But very few worry about the pills already sitting in their medicine cabinet. And that's exactly why today's video could change the way you look at your health forever. Imagine a 68-year-old man named David. He follows his doctor's advice. He takes his medications exactly as prescribed. He exercises when he can. Yet over the course of a year, he starts feeling weaker, more tired, and strangely short of breath. He assumes it's just aging. It wasn't. The surprising truth is that many symptoms people blame on getting older are sometimes connected to medications that no longer fit their body's changing needs. The medicine didn't suddenly become dangerous. The body changed around it. And that difference can matter far more than most people realize. I'm going to show you 5 common medications that deserve a second look after age 65. This isn't a panic video. It's not about throwing pills away or ignoring medical advice. It's about understanding hidden risks and learning how to ask better questions before problems quietly develop. As a clinician who has spent years working with older adults, I've seen one pattern repeat over and over again. A medication that worked perfectly at age 45 may behave very differently at 65, 75, or 85. That's because aging changes nearly every system involved in processing medication. Your kidneys filter more slowly. Your liver processes drugs differently. Blood vessels become less flexible. Even body water and muscle mass change. All of these factors influence how medications travel through your body. The result is simple. What helped years ago may require a completely different approach today. Before we begin, remember this. Never stop a prescribed medication without speaking with your healthcare provider. The goal of this video is awareness, not fear. Sometimes the safest decision is continuing a medication. Sometimes it's adjusting it. The key is making informed decisions, not emotional ones. The first medication group may surprise you. It's certain sleep medications often used for insomnia. Many older adults take them because they seem harmless. After all, getting good sleep is important. But the way these medications affect the aging brain can create risks many people never consider. These drugs work by slowing activity in the nervous system. That's why they help people fall asleep faster. The problem is that in older adults, the effects can linger into the next day. Balance, coordination, reaction time, and alertness can all be affected without obvious warning signs. Research has consistently linked certain sleep medications to increased fall risk in older adults. A single fall can lead to fractures, hospitalization, loss of independence, and months of recovery. Many people never connect the accident to the pill they took the night before. One retired teacher I worked with couldn't understand why she felt unsteady every morning. She blamed her age. After reviewing her medications, her physician adjusted her sleep treatment plan. Within weeks, her morning dizziness improved dramatically and her confidence returned. A safer alternative may include sleep hygiene strategies, consistent schedules, reduced evening screen time, or cognitive behavioral therapy for insomnia. Ask your doctor whether your current sleep medication is still the best option and whether a lower-risk approach might work equally well. The second group involves medications commonly used to control acid reflux and chronic heartburn. Millions of adults take them every day. Many start using them for a short-term issue, then continue for years without ever revisiting whether they still need them. These medications reduce stomach acid. That's exactly what they're designed to do. But stomach acid also plays an important role in absorbing certain nutrients. Over time, reduced absorption may contribute to deficiencies that affect energy, nerve function, and even cardiovascular health. One hidden concern involves magnesium levels. Magnesium helps regulate heart rhythm and muscle function. Long-term use of some heartburn medications has been associated with lower magnesium levels in certain patients, particularly when use extends for many years without monitoring. A man in his 70s once described feeling exhausted despite normal heart tests. Blood work eventually revealed nutrient deficiencies that had developed gradually over time. Addressing those deficiencies and reviewing his medication plan helped improve both his energy and overall well-being. If you've been taking a heartburn medication for years, Ask whether periodic monitoring of nutrients makes sense for your situation. Sometimes the answer is yes. Sometimes it's no. The important thing is making sure the conversation actually happens. Third on the list are certain anti-inflammatory pain medications. Many people use them for arthritis, back pain, or chronic joint discomfort. They can provide meaningful relief, but daily use over long periods deserves special attention after age 65. These medications can influence blood pressure, fluid balance, and kidney function. For someone with existing heart disease or high blood pressure, those effects may place additional stress on the cardiovascular system. The risk increases when use becomes a long-term habit. One study after another has shown that prolonged use may increase the likelihood of certain cardiovascular complications in susceptible individuals. That doesn't mean everyone should avoid them. It means their benefits and risks should be reviewed regularly instead of assumed indefinitely. A former construction worker used pain medication daily for years to manage knee discomfort. Eventually, his blood pressure became harder to control. After discussing alternatives with his healthcare team, he incorporated physical therapy and reduced medication reliance. His readings gradually improved. Potential alternatives may include targeted exercise programs, weight management, physical therapy, heat therapy, or other pain management strategies depending on the condition. Every situation is different, which is why personalized advice matters so much. Number 4 is one many people overlook completely: certain over-the-counter allergy medications. Because they're sold without prescriptions, people often assume they're automatically safe. But some older formulations can create unexpected problems in seniors. These medications may cause confusion, drowsiness, dry mouth, blurred vision, and difficulty urinating. In older adults, even mild cognitive effects can increase fall risk and interfere with daily activities. Sometimes family members notice changes before the person taking them does. A hidden danger is that these effects may be subtle at first. People often assume they're simply becoming forgetful or slowing down with age. In reality, medication side effects can sometimes play a larger role than expected. One older gentleman stopped driving at night because he felt mentally foggy. After reviewing his medications, his doctor identified an older antihistamine as a possible contributor. Switching to a more appropriate alternative significantly improved his clarity. Modern allergy treatments often provide symptom relief with fewer cognitive side effects. If you're taking an older allergy medication regularly, ask whether a newer option might better fit your current health profile. The 5th medication category is perhaps the most controversial: certain over-the-counter combination cold medicines. During flu season, many people reach for them without hesitation. Unfortunately, they often contain multiple active ingredients working in several different ways at once. Some ingredients can increase heart rate, elevate blood pressure, or interact with medications already prescribed for cardiovascular conditions. The danger isn't necessarily the cold medicine itself. It's the unexpected interaction happening behind the scenes. A shocking reality is that many people don't know exactly what's inside the products they purchase. 2 different cold medicines may contain overlapping ingredients. Taking both can unintentionally double the dose without the person realizing it. A retired accountant experienced sudden blood pressure spikes during a winter illness. After careful review, his healthcare team traced the issue to an over-the-counter cold product he assumed was completely harmless. The problem resolved after changing products. Before taking any cold medication, especially if you have heart disease or hypertension, read every ingredient carefully. Better yet, ask your pharmacist which option is safest for your specific health conditions. Let me ask you something. Which medication category surprised you the most today? Was it sleep aids, pain relievers, heartburn medications, allergy pills, or cold medicines? Share your answer in the comments because your experience might help someone else watching. Here's something many people never hear. Medication risk isn't only about the drug itself. It's about the combination of your age, your organs, your genetics, your medical history, and every other medication you're taking. That's why 2 people can have completely different experiences. At your next appointment, ask this simple question: if I were starting from scratch today, would you still prescribe this medication at the same dose? That single question often opens conversations that otherwise never happen. Another smart strategy is creating a complete medication list. Include prescriptions, vitamins, supplements, and over-the-counter products. Many interactions are discovered only when every item is reviewed together rather than individually. The encouraging news is that modern medicine is becoming more personalized every year. Doctors now have better tools, better research, and a deeper understanding of how medications affect older adults. Problems that once went unnoticed are being identified earlier than ever before. I remember hearing about a woman in her 70s who felt increasingly weak and discouraged. After a comprehensive medication review, several small adjustments were made. Nothing dramatic. Yet within months, she was walking farther, sleeping better, and enjoying activities she thought she had lost forever. Getting older doesn't mean accepting every symptom as normal. Sometimes wisdom isn't adding another pill. Sometimes wisdom is asking whether the current plan still serves the person you've become. Today we covered 5 medication groups that deserve extra attention after 65. Sleep medications, heartburn treatments, anti-inflammatory pain relievers, older allergy medicines, and combination cold products. None are automatically bad. They simply require thoughtful review. If this video helped you see your medications differently, please subscribe and share it with a friend or family member over 65. One conversation with a doctor could prevent months or even years of unnecessary health problems. And finally, remember that this video is for educational purposes only and should never replace professional medical advice. Always speak with your doctor, pharmacist, or healthcare provider before making changes to any medication or treatment plan. Your health decisions should always be personalized to you.